Welcome back. It's now 12:27 and new technology is making joint replacements a whole lot easier. Dr. K. David Moore is a board-certified orthopedic surgeon at Andrews Sports and Medicine and Orthopedic Center. And Dr. Andrews, I understand that we were just kind of briefly chit-chatting about this new technology and all of the benefits, but let's talk about the technology first and foremost.
Right. Well, we're very excited to be able to bring this technology to our patients at Andrews Sports Medicine. We've been doing this for about 7 or 8 months. We've done over 500 total hips and total knees with it at this point. And it's really been a game changer for us.
And this is a robotic system, or what is it exactly?
It's called the Mako Robotic-Arm, and it's used as an assistant in surgery, essentially.
And for surgeons, how does this make things easier and more efficient for you all?
Right, so I've been doing this surgery almost exclusively for almost 25 years, and this has been a real game changer, probably the biggest benefit to the patients that I've seen during that time. It makes us more accurate. It allows us to customize the surgery to the patient's anatomy and to their biomechanics.
And we were saying how that's what makes your job easier, but on the patient and the patient recovery side, it makes things better as well. And
right.
Talk about that for us.
In our early experience with it, it seems like it's a much quicker recovery for the patients, and our hope is that as time goes on, because it's so much more accurate, it's going to make these joints last longer as well.
And so you've had patients, how many patients roughly have you had with this surgery so far using this robotic?
As a group, we've done over 500. And I've done several, probably 30 or 40, where we've done one side the traditional way and the other side with a robot, and almost universally people have thought it was a quicker recovery with the robot arm.
When you say quicker recovery, I know it's a long recovery when you get a hip or a knee replaced. Does it significantly shorten the recovery time, or?
Well, so what the robot does for us in part is allows us to customize this to the patient's own biomechanics. So we're kinder to the soft tissue, and I think that means a quicker recovery, less swelling, less pain after the surgery, and they're up and going more quickly. And
how many people, or how many groups, medical groups in this country are using this system right now?
I don't know that I can give you the numbers countrywide. It's growing every day. We started this, we're the first group in Birmingham to do it, and we started back in September, but we're seeing already other places around the southeast begin to catch on.
So this is something that could change the game across the nation and even world.
I think it's really going to change the way this surgery is done.
All right, well, thank you so much. Really cool information. If people want to find out more information about the surgery, if they're perhaps contemplating a hip or knee or major joint replacement, how can they get more information?
Probably the easiest thing to do is just check out our website at andrewsportsmedicine.com.
Okay, all right, thank you so much. We appreciate your time.
Thank you.